Hi, good evening, everyone. Dr. Mehta here. Just again, a couple housekeeping items. If you can mute your microphone for the duration of the talk, and then towards the end of the talk, we will allow for questions and answers. Okay. Um, so again, thank you for joining our doc talks, our monthly doc talks here at Dayton Outpatient Center. Just to again briefly go over what Dayton Outpatient Center is, we're focused on interventional pain and chronic pain management. We do find ourselves being one of the leaders in the area in kind of new innovative therapies for spine care and orthopedic care. And so a lot of the talks we've discussed, focused on your health and well-being. And this talk specifically is something near and dear to me where I've spent a lot of time both in training and clinical practice and kind of utilizing new waves of therapy to treat our pain and to help it not only control inflammation, but now talk about healing. How do we actually heal tissue that's been damaged for so many years? And so this is where a lot of the new up and coming research is in how do we avoid surgery? How do we provide other ways to treat patients' pain in more of a healing format? And so both PRP and stem cells is something that I currently clinically do in my practice on patients, is something that we do research on in our practice, and hopefully something that you all can be well educated about and maybe interested in down the line. So, with that being said, why are we using biologics? Well, we know that there's a lot of gaps in treatments between the conservative approach and then surgery approach, right? And so many of the things that we do in pain management in our clinical practice are anti-inflammatory medications, injections, cortisone, therapy, things like that. But PRP and stem cells has now allowed us to offer more a regenerative type of treatment as that in-between step from conservative to actual surgery. And so what is the goal here? The goal is to improve performance, right? Improve your ability to do things that you love, whether that's going to the grocery store, taking care of your grandkids, doing something really active like running or biking or jogging. Those are really what the focus of these therapies are, is to really repair the tissue, replenish the cartilage, replenish the injury so that you can get back to what you love to do. What are the common conditions that we treat with these biologic therapies? And biologics, I'm talking about PRP and stem cells. And so you can see here a list of some common conditions. We treat a lot of arthritis. We treat a lot of tendonitis in the elbow, a lot of foot pain from plantar fasciitis, Achilles tendinopathy, shoulder issues, whether you have a rotator cuff tear or tendinosis, as well as knee meniscus injuries and tendon issues. And then finally, something that we're really focusing on in our practice and is pretty unique to our practice is we do a lot of stem cells for back pain, for patients with degenerative disc disease, with SI joint disease that may not have gotten better with conservative therapy. And so, let's talk about some of the big players as to why this treatment works and why it works well. Well, one of the main conditions that we use this therapy for is osteoarthritis, right? And so what is osteoarthritis? It's just really a fancy term for saying that there's loss of cartilage to the bones. And so you can see in this picture on the left, there's normal cartilage, that white glistening substance is cartilage. And then over time, on that right side, you see that there's a lot of bone formation. That white glistening substance has lost its structure. You now develop bone spurs. And so that's what we're talking about when it comes to arthritis. That cartilage has lost its ability to lubricate the joint or let that joint move very freely. And so why do we develop arthritis? Well, multiple reasons. One, it can be genetics, plays a big role. Just normal age, normal wear and tear to the joint. And if you've had previous history or work conditions that really predispose you to getting further wear and tear to that joint. And so we know what happens is as the arthritis progresses, we trigger this whole inflammatory cascade, right? And that's why we have pain. We don't have pain just because the cartilage has worn down. We have pain now because of inflammatory markers, cytokine release, chondrocyte, altered metabolites into that environment is now eliciting pain. And you can see how complex that environment is Whether it's our body composition that's causing the arthritis to wear, or is it just nutrients, hormones, and just the balance we have in our body is causing these progression of arthritic conditions. And so, like I said here, why does osteoarthritis progress? Well, the environment and the tissue has now become more destructive rather than productive. And so that tissue just wears down over time. And so, unless we have a way to prevent that cell breakdown, prevent that progression of disease, that arthritis will progress. And so that's really where the forefront of stem cells and PRP and bone marrow has really provided a way to limit that progression of arthritis. And so here's just another example of grading. Not arthritis is not all created equal. And so there's different staging of arthritis, to mild to severe. And so any stage of these grading of arthritis can cause differences in pain. And every stage in these grading can cause different therapies to work better. And so we'll talk about the staging and how that applies to the stem cells. Here again on X-ray, what we see is on this left image here, we see the normal joint space, and you see over time that cartilage loss, that joint space has just completely narrowed. Here again, the knee is an example of arthritis, but we also treat lots of hips. Again, you have that normal joint space that you see on X-ray. And then over time, that joint space has just completely collapsed and narrowed. And so that's where there's developed bone wear and tear. And so if an orthopedic surgeon sees this image, certainly a hip arthroplasty or total hip replacement is probably the next stage in therapy. However, where can stem cells, where can PRP, where can regenerative therapy really plug in as far as providing pain relief and functional recovery so that we can avoid that hip surgery down the line? What about soft tissue? So we talked about cartilage wear and tear, but what about the tendons? What about the cartilage? What about the meniscus? So that's really where a lot of the stem cells has a role in actually treating the tendons as they've worn down. And so we know that tendons get worn down because of decreased range of motion and decreased blood supply. And so what we do with the stem cells and the PRP is what we're doing is we're drawing your blood so that we put those growth factors where healing needs to happen. And so we can inject these therapies into the tendons, into the joints, into the muscles to help those muscles recover where normally they won't recover in a quicker fashion. And so, why do tendons cause pain? Well, we know over time there's lots of forces that develop over the joints. For example, I see a lot of tennis players, and as they're hitting in that repetitive motion, they get a lot of wear and tear here. I see a lot of people using their hands, factory workers, and they get a lot of tendonitis in their hands and their thumb. And so that just because of that repetitive use, it's putting a lot of strain on that tendon, often leading to pain, often leading to tears. And so steroid shots can calm inflammation. However, they're not repairing the tendon. And so that's where, again, this therapy can really repair the tissue. Here's again on ultrasound what we're looking at as far as the tendon is damaged. And so you can hear on this picture on the left where you have this red indicating some mild wear and tear, and then all of a sudden there's a partial thickness tear where there's now inflammation, and then finally it could lead to a full thickness tear where it actually retracts away from the bone. And so I use ultrasound a lot in my practice for diagnosis as well as guidance on injections. And so here's just kind of a depiction of what I'm looking for in ultrasound as to where the tears might be. So now let's kind of jump into how do we treat arthritis? How do we treat these tendon injuries with PRP and stem cells, right? And so basically what we're doing is we're obtaining your blood, right? So your own cells are being used in repairing your tissue. And so what we do is we do a blood draw where we actually draw out what's called plasma or platelet-rich plasma. And so that's the yellow substance you see. You might, see when you get a blood draw at your primary care office, they actually draw the red blood, but then when they spin it, you actually see the white cells and the plasma go above and the red blood cells below. And so those yellow cells are very healthy cells. Those yellow cells have a lot of repair tissue to it. They have a lot of mechanisms to actually heal the tendons. And so what we do is we draw that yellow substance, and that is what we're injecting into the tissue that we're talking that is causing pain. And so what are stem cells, right? Stem cells are the worker cells. They're really derived from our muscle, our bone, our cartilage, or tendon. So you can really harvest them from multiple areas. Blood is one common area that we harvest from. And so when you take those worker cells, I like to call them, and you put them in the environment that they need to be, they start to grow into that tissue. And so if you take stem cells from your blood or your bone and you put them in your knee, you're going to try to regrow that cartilage. If you put them into the tendon, you're going to start to regrow tendinous tissue. And so those stem cells want to be in the environment that they're supposed to be in. And so that's why, we use these cells to actually repair the tissue. And so, again, like I said, where do these cells live? They live in the bone marrow, fat cells. They live in your dental tissue. They live in your blood. They live in your umbilical cord. So there's a lot of ways where we can harvest these cells. Again, where we find the most cells derived from is really your own bone marrow and your own blood. So, like I said here, how we derive the cells, we can either derive it from your blood, or we can actually derive it from your bone. And so what we do is another treatment called bone marrow aspiration, where we target the bone, we actually draw up the blood, we spin it in our specialized centrifuge, and then we inject that into the area of target. PRP, like I mentioned, is your blood draw. Your normal blood draw takes about 30 cc's of your blood. We spin it in that centrifuge, extract that yellow substance, and then inject that into the tissue to help with the healing. So, like I said, with the platelets really are helping us heal. If you get a cut on your arm or your knee, platelets are the first to go to that environment to help that injury heal, right? Same thing here is we're putting platelets, a high concentration of platelets into the target area. So into your knee joint, into your shoulder joint, where there's not a lot of healing to begin with. And so we're promoting that growth by injecting these substances into your area so that it can heal over time, just like a cut would. Is there a risk for stem cells or PAP, right? That's what I get questioned. The stem cells, right? Is it safe? Is it going to cause things down the line? Well, because these stem cells are your own, there's low risk of getting cross-contamination or any altered factors, to these stem cells, right? I draw it out, I spin it down, and we inject it right back. So there's not a lot of manipulation of these stem cells, like some of the other products that might be sold to you, at other practices. Since 2019, there's been over 15,000 studies utilizing stem cells with limited side effects. And again, like I said, FDA has approved the use of these stem cells in order to treat patients' pain, as long as they're not manipulated, which they're not in our practice. The whole slew of articles and literature to support how stem cells work and what they're used for, that's really where a lot of the technology and the data is driven is on stem cells for arthritis, for tendon pain, and then now we're getting a lot of evidence for degenerative disc disease and disc pain. So, I always say buyer beware, right? Not every practice is created equal. And so, as you can imagine, stem cells has gained a lot of interest. And so there's been a lot of what we call stem cell clinics that have opened up, driven by other providers. And so, I do caution as to going to other providers or other non-vetted individuals that don't have the research backing because, they might give you stem cells that's not the actual product, or they might give you something that is not as higher yield or your own product. And so there's been a lot of crackdown on clinics that have not been doing this in the most accurate way. And so I just caution other practices that are utilizing these stem cells. Make sure the provider you're getting this with. Make sure they're a vetted practice that does the research and backing to this novel therapy. And so, kind of going into some questions that I often get asked as far as regenerative medicine is that, when will it start to work? So typically, when we do an injection, it takes about 6 to 8 weeks to start noticing any difference, and usually about 3 to 4 months before pain relief. So the this is much different than a cortisone shot, right? Cortisone you might get and you might notice instant relief. What we're doing here with the stem cells is we're trying to repair the tissue. That tissue needs to heal. That tissue needs to repair over time. So typically the recovery is about 3 to 4 months down the line. Now, how long does it last? These therapies can last years, right? So once the tissue is repaired, that pain can go away. And so, unlike cortisone, where often you might need a series of injections or every 3 to 4 months you're getting a cortisone in your knee, PRP is a one-time thing. I do PRP once. We kind of monitor you over years, and then we decide, do we need another one, if things have progressed. And so that is the important distinction of the common cortisone route and the stem cells route. When can I start to be active after my treatment? So typically, physical therapy, exercise, your home program can start a week after treatment. I want those cells to get better, to really get into the environment that they want, and then you can start to do your activities. Do I need to avoid any medications? Typically, we do like patients to avoid blood thinners, just purely because we want to bring stem cells, we want to bring kind of that blood product to the joints. And so if we limit the blood product or control the inflammation in that area, we will limit the effect of the PRP. So typically I ask patients to stop anti-inflammatories 1 week before the procedure and then 1 week after the procedure. Um, Another common question I get asked is, I don't have any pain. Should I get treatment? Well, a lot of the PRP and stem cells, like I mentioned, is repair and regenerative, right? So a lot of the treatments can be used for preventative medicine, right? If we know that, hey, our tendon is worn down or we starting to progress with some arthritis in the knee, we might not have a lot of pain. Doing these types of therapies can actually help you repair the tissue while you're not in pain so that we can avoid the painful episodes down the line. We can avoid the really severe episodes where you have to go to the ER because of pain. And so that's really the idea is not only are we treating the current symptoms of reducing pain, but we're also preventing disease down the line. Another question is, the ortho told me I have bone-on-bone arthritis. Am I a candidate? Really the data now shows that even with bone marrow stem cells does have a role in controlling pain. And so there's not really a candidate as far as the severity of the disease that we can't consider this therapy for. And then, we talked about this, how many treatments are recommended. Typically, it's patient to patient. I usually do one treatment as far as one injection into an area, and then we decide, do we need to, target other areas or have a subsequent treatment. And so, finally, as far as the regenerative medicine, it's getting more traction, it's getting more knowledge as far as what this therapy does. The downside is that insurance has not picked it up as coverage yet. And so, the hope is that at some point, insurance will consider this therapy as a viable option for patients and start to cover it under insurance carriers. But currently, it is not covered. And so we do in our practice offer cash pay options for this therapy. I listed here kind of the fee structure for the typical areas. If you're getting multiple areas in one session, there are some discounts of that. But we utilize these therapies for the evaluation, the drawing the blood, the spinning of the blood, the injection, kind of it's all encompassed in one procedure. And then the follow-up associated with that. And so if you think about how much cortisone and the cost of cortisone and what it does to your joints, over and over, the cost of efficiency or cost effectiveness of going through a stem cells or PRP or avoiding surgery down the line can be very cost effective. And so we have payment plans, we have care credit that can use, towards these therapies, but certainly something that your provider should know about. And so, finally, I think DOC really strives on utilizing these therapies. We do have 2 clinical research trials right now that are going on for degenerative disc disease. So this is an industry-sponsored study where there's actually no cost to you. And what we do is we're actually utilizing stem cells to inject that into the disc. And so if you're interested in the clinical research study, feel free to reach out to myself or your provider, and we can kind of see if you're a candidate for that study. But hopefully this gives you some outlook into what is the up and coming therapies, what are the new options that I can offer as far as treating your pain. Because certainly I believe stem cells, PRP, and bone marrow is going to be the future of how we, treat our patients, not only controlling pain, but now thinking about how we can repair that tissue and improve longevity of our health. And so, with that is really the end of the talk. I will kind of unmute you guys and leave it open to questions via voice or text.
You know, this therapy has been out for a long time. What would it take for insurance companies to help provide the payment? You know, they're doing it for so many other things. What gives them the opportunity to finally say, Medicare, Anthem, somebody's going to pay for this?
Yeah, great question. I wish I knew the answer to that. I think there in my mind, why I do it in clinical practice is because to me there's a lot of evidence to support it. Now, insurance carriers have a different viewpoint. And so it's really up to them to kind of decide, hey, is this beneficial? Now, stem cells has been used for years. They use it in orthopedic procedures while they're doing a knee replacement. They put stem cells in during the operation. In dental implants, they do stem cells and that, for over 30 years. And so those are all covered treatments. But when it comes to controlling pain and other areas, to insurance carriers, the jury's still out. And so that again, I think the more data we provide, the more patients we treat, the more evidence that we provide, the better it is for insurance carriers to eventually cover it.
When would you use bone marrow versus blood?
Yes, excellent question. So, bone marrow, I typically like for my patients with moderate to severe arthritis. And so, when we're talking about the knee arthritis, the shoulder arthritis, the hip arthritis, when the surgeon is like, you need a hip replacement, I typically like to use bone marrow because that houses the most stem cells. And so, that's where I think there's a better benefit and more of the evidence for using bone marrow. PRP is a great therapy as kind of that initiator. For mild arthritis, it can be beneficial. For tendon issues, for rotator cuff tears, for Achilles issues, patellar tendonitis, plantar fasciitis, all those conditions where you think of tendon, PRP is really the go-to for that condition. And so it's kind of a judgment call. We'll look at your X-ray, we decide kind of what makes sense, and then target that therapy that would be best beneficial. Good. I know a couple of you have a question about, how do I check in the clinical trial? So what we'll do is, we have your names, and then I'll send that to our research staff so they can kind of look through your clinical chart and see if you meet criteria. If you meet criteria, we would call you in for a visit, and kind of go through the screening process and what we do as far as the trial to see if you qualify. If there's someone that is interested in the research that is currently not a patient of ours, I can share if you dial 937-252-2000 and you get the extension of the research department, they can kind of answer those phones and guide you through that process. Good. Any other questions from the group as far as the stem cells and the treatments? Well, great. Well, hopefully this was, educational for you as far as learning what is up and coming and what kind of therapies we're doing at DOC and, and the most advanced technologies. These lectures, like I said, will be on our website. They're on our YouTube page. So feel free to, view it again, share it with your friends and family if you need to. And again, always feel free to consult with your provider. If one of these therapies interests you, certainly everyone's knowledgeable about what would make sense for you guys as patients. So, again, thank you guys for joining, and then we'll see you next month.